Welcome, and thank you for joining us today. There is so much energy at Ignite this year. I hope you're enjoying the program so far. My name is Kees Hertogh, General Manager, Global Industry Marketing at Microsoft, and it's such a pleasure to be with all of you here today. In today's session, we will cover, as part of ongoing investments in the Microsoft Cloud for Healthcare, first, how do we looking to unlock the value of the organization's data in healthcare with new offerings? Secondly, how does Microsoft enable these organizations to leverage the power of AI? And lastly, our continuous focus on responsible AI in context of healthcare. The cross-industry view is fascinating at many levels, not the least of which is our ability to see common challenges that industry face. At the same time, we're also able to see what certain industries are successful in leveraging the power of technologies to accelerate their most critical business outcomes, while others, including healthcare, continue to lag. The COVID-19 pandemic gave us a glimpse of what was possible. When emergency circumstances demanded that public and private healthcare systems be able to communicate seamlessly, we saw pockets of excellence emerge. With focused efforts, healthcare organizations unlocked the power of data, and we saw an unprecedented collaboration with unique insight and heightened levels of patient care. Recognizing what's possible with the right technology in the right place, Microsoft feels an incredible sense of responsibility to help expand these pockets of excellence and drive a systematic change that transforms patient care. And so today, I want to spend our time together talking about the right data strategy and AI investments that can help you accelerate your work in three areas where I know healthcare organizations are constantly looking to raise the bar for patients and healthcare workers, offering better experiences, better insight, and eventually better care. With technologies that is designed to address the specific complexities of healthcare environments, our focus is on making it easier for health organizations to create connected experiences at every point of the spectrum of care. So let's start with the first imperative of patient care experience. As patients ourselves, we all have heightened expectations around the degree of which the care we receive is personalized. When I have an encounter with my doctor, I want to feel like they are up to date on my whole health history, that there are no gaps in their view of my information. And yet, all of us understand this is difficult to achieve. Patient information is still distributed in siloed systems and formats, and at the same time, the amount of data being generated in healthcare is staggering. The growth rate of data in healthcare is expected to exceed that of any other industry through 2025. When we talk about better experiences, we know that data is a driver to success. I'd like to share a story of 𝗦𝗲star, which is one of the largest and most integrated healthcare systems in Georgia. They needed a way to unify their data across all touchpoints, clinical, administrative, customer service, and digital engagement, and apply analytics to identify what data was most relevant for any given situation. Their omnichannel platform initiative provided a 360-degree view of each patient and enables personalized communication and care experiences. And now, let's hear a bit more about 𝗦𝗲star's integrated approach to healthcare. Let's roll the video.
Our mission is to serve with compassion, to honor every voice, to pursue excellence, to create a healthier community, healthier patients, healthier people.
𝗦𝗲star is Georgia's largest nonprofit hospital system. We provide $1.1 to $1.2 billion of free healthcare each year. We care about getting the right solutions and getting patients a better health outcome.
We're always looking to fill care gaps, looking to fill areas where the patients may not realize that there are services that really would benefit them. What does a patient need? What does a patient want?
What we're seeking to do is use clinical insights, physician insights, population insights, reach people in a way that is novel and beneficial.
We partnered with Microsoft Cloud for Healthcare to create that holistic data environment, to integrate these different disparate data sources, match them up, and create a holistic picture of a patient.
Choosing Microsoft Cloud for Healthcare for personalized patient outreach was super intentional. HIPAA compliance, data protection has never been more important. Having a platform with the history and security footprint that Microsoft offers made that decision pretty easy.
We are able to create a more overall circular, holistic solution. Previously, we were not able to really segment it all.
Now, our marketing team is using it to establish complex segments based on a clinical insight, an engagement or digital insight, or somebody saying that they want specific help for some condition.
We're able to segment our patients based on communication preference, provider, location, appointments, encounters, showing that we care about you as a person and a patient. The benefits have been great so far. From a provider standpoint, you're getting to know your patients better, what is important to them, and what things they may need to work on.
When caring for our patients, we've been very successful at driving patients to understand their health better.
That relationship, patient and provider, is being strengthened because of Cloud for Healthcare.
We care for every patient that comes through our doors. We want to make sure that everything that is a concern to them is accounted for. Using Microsoft Cloud for Healthcare, we're able to create that kind of experience for our patients and provide them the care that they truly need.
So we heard how 𝗦𝗲𝘀 is clearly committed to their patient relationship and are looking to fill care gaps. It's a culture of curiosity driven by the desire to ensure they are getting to the root of what their patients need. It's inspiring to see how by creating a more connected view of data from across their systems, 𝗦𝗲𝘀 is now able to create a full picture of each patient that includes patterns and preferences for a more personalized care. And this is when we can start to talk about the second imperative of creating better insight. As I said, the volume of data that surrounds us in the workspace is overwhelming, no matter what industry we work in. But in the case of healthcare, finding the right data could be life-changing for our and your patients. According to the World Economic Forum, hospitals produce 50 petabytes of siloed data per year. To put it in terms that we can all understand, this is equivalent to approximately all of us taking 4,000 photos every day for the rest of our lives. However, 97% of this data goes unused. Putting all this data to good use is the key to unlocking clinical and operational breakthroughs. The question is, how do you make sense of all of this and use it to your advantage and to the advantage of key healthcare scenarios? Once you've migrated your data to the cloud and have an end-to-end view of your first and third-party data, it starts to get really interesting. You can apply machine learning and AI investments to new data connections and generate predictive insights. Now, with your data state in order, you can pivot quickly in response to changes at patient level in the population health, the regulatory space, or in your organization's competitive landscape, and quickly navigate any situation that requires a what-if analysis. AI can be an essential accelerator for reaching the necessary scale and pace of change, ensuring your data is working for you. We started with your needs in mind, and in May of this year, we unveiled Microsoft Fabric, a unifying platform for data analytics designed in the era of AI. Fabric unifies all analytics tools at every layer into one product with one experience and one common architecture. And what this means is that organizations can get a unified product experience for all their data professionals to collaborate in. A unified governance providing a single source of truth for everyone in the organization. And a unified business model to ensure they are using their resources in the most cost-efficient way. In October of this year at HLTH, we announced the private preview of healthcare data solutions in Microsoft Fabric, one of the first Fabric industry solutions that eliminate the costly, time-consuming process of stitching together complex data sources for healthcare and life sciences organizations. Out of the box, Microsoft Fabric will help you in a number of ways. It enables you to transform your data into predictive insight, ensuring better care management. You can reduce costly data applications and movement to support your data analysts and data scientists. And with these solutions in place, your organization can also automate duplicate tasks, resulting in data efficiency and resource management. And what's especially great is that you can self-serve, meaning you can equip everyone in your organization with their own access to these powerful analytics. Underscore all of this is a commitment to help keep your data secure and protected in a single source while meeting your most stringent compliance requirements. Let's take a look at an example of how healthcare data solutions in Microsoft Fabric can support your organization in their data journey. Let's roll the video.
Healthcare data is often scattered across different providers and platforms, making it hard to get a complete picture of a patient's health journey. This slows down decision-making, extends costs, puts additional strain on the workforce. It makes it difficult to deliver seamless, personalized care to patients. We'll show you how 𝗦𝗲𝗻, a director of data innovation, addresses these problems with Microsoft Cloud for Healthcare in the new Microsoft Fabric with AI and business intelligence that empowers teams to unlock their data potential to help derive timely insights. 𝗦𝗲𝗻 starts in Microsoft Fabric. Within the healthcare data solutions, we see the capabilities 𝗦𝗲𝗻 can leverage to aggregate health-relevant data from various solutions. These capabilities create a data foundation for analytics, enable collaborative apps, and support AI applications to improve workflow inefficiencies and operational challenges across 𝗦𝗻𝗻's organization. With these healthcare-specific capabilities within Microsoft Fabric, 𝗦𝗻𝗻 can centralize and curate data within a unified, governed hub. This helps ensure all teams are drawing insights from a single, secure source, enabling 𝗦𝗻𝗻 to continue transforming the data and expanding the connectivity by enriching data through the levels of bronze, silver, and gold lakehouses. With a single enriched data source, Microsoft Fabric empowers data analysts like Danny to support clinicians and generate reports with near real-time insights using natural language. This helps create a 360-degree view of patients. It informs more in-depth care management programs and highlights areas for improvement. It also ensures clinicians can confidently use protected health data at scale in patient population groups, clinical trials, and across care transitions. Using AI to create clinical trial cohorts can be life-changing for patients like Patty. Historically, the time taken to visit multiple specialists in her diagnosis journey can be considerable. Thankfully, Patty's care team can now access secure, connected data and use the Clinical Trials Matcher AI model to help trials align to her conditions. This empowers her care team to review, purpose, and explain clinical trials for which Patty is eligible. Microsoft Fabric and the rich range of healthcare Azure AI services break down traditional data silos, all adhering to industry standards to the principles of responsible AI. We saw how 𝗦𝗻𝗻 used Microsoft Fabric with some healthcare Azure AI services to enable a single source of truth that speeds up decision-making. Danny supported clinicians by generating reports with real near-time insights using natural language. Lastly, we saw how Clinical Trials Matcher empowers Patty's care team along with enriched data and AI to align trials to her conditions, all while minimizing the strain on the workforce and helping to reduce costs. Better experiences, better insights, better care with Microsoft Cloud for Healthcare. Learn more at aka.ms/cloud for healthcare.
To spark your imaginations, I thought I'll share a couple of instances on how healthcare organizations and their patients will benefit from better insights. Starting with Northwest Medicine in Chicago. It's a Chicago-based healthcare organization starting its journey towards a unified data and AI strategy. They will use Microsoft Fabric for a lakehouse-centric approach and its capabilities to combine data models, data pipelines, and analytical dashboards. Sing Health, Singapore's largest network of healthcare institutions, plans to harness the combined power of Microsoft Azure OpenAI Service, and Fabric in healthcare for its underlying data infrastructure to alleviate the challenges they face with on an aging population and an increased administrative demands. Healthcare data solutions we're launching in Microsoft Fabric won't be limited to increase productivity or optimize processes. It will also support scenarios like personalized healthcare to patient triage and clinical documentation to efficiency drug development and discovery. And now I'm turning it over to Ken Harper, Vice President of Dragon Ambient Experiences at Microsoft, to talk about a third imperative, which is all about enabling better care. Over to you, Ken.
Thank you, Kees. So when we think about better care and experiences in healthcare, one thing that's really important to remember is it's not only the care of the patient, it's also what is the experience for clinicians and care workers that are providing that care. And it's no secret that here in the United States, health systems and organizations continue to grapple with the physician burnout and clinician burnout within their system as a result of all the administrative work we're asking our care workers to take on. And unfortunately, clinician burnout is at an all-time high. 53% of clinicians now feel burnt out while on the job. And this isn't trending in the right way. This is actually trending in the wrong direction. And so when we think about better experience and this burnout that care workers are facing, we also have to think about, well, what's then the impact on us as patients? Are they able to focus on us, or is their attention diverted on this other administrative work we're also asking them to do? So with this being the focus, we're very excited to have announced the general availability of DAX Copilot in September. And DAX Copilot is a reimagination of the clinician-patient experience. With DAX Copilot, a clinician can simply walk into an exam room or join a telehealth visit, focus on the patient, give them eye contact, converse with them naturally. And they can do that because DAX Copilot is on their side, creating a high-quality draft note based on the context of that conversation. This allows the clinician to focus their time and energy on the patient. This has all been made possible because of 2 decades of conversational AI experience that Nuance has had, combined with highly optimized ambient AI that's been trained on tens of millions of clinical encounters. And of course, all of this is being powered by the Microsoft Cloud for Healthcare. So we'll go ahead and let you see how DAX Copilot works now.
Introducing DAX Copilot, your AI assistant for automated clinical documentation. Formerly known as DAX Express, this new addition to the Dragon family relieves administrative burdens to increase clinician satisfaction, improve patient experiences, boost operational efficiencies, and achieve financial outcomes across specialties. This industry first combines proven conversational and ambient AI with the most capable generative AI, amplified by the power of the Microsoft Cloud for Healthcare and Azure. Using a secure app or supported EHR mobile app, DAX Copilot captures the complete patient story. And in seconds, converts multi-party conversations into structured and specialty-specific clinical summaries that are immediately available for review and editing. Clinicians can view and access all available clinical summaries in the app or directly in the EHR. Using just their voice, clinicians can tap into a full suite of customizations, templates, and shortcuts that allow them to personalize their notes using Dragon Medical One's advanced speech capabilities and time-saving EHR workflows. As part of the Microsoft Cloud, DAX is delivered through a trusted, reliable infrastructure and global platform, guided by an established responsible AI framework and core set of principles. It's secure, flexible, and scalable, and the results speak for themselves. Better work-life balance, higher job satisfaction, greater documentation quality, and more focused, personable, and conversational patient visits. With DAX Copilot, automated clinical notes are just the beginning.
One of the things we were able to do was deploy DAX Copilot in a private preview program, and Atrium Health part of Advocate Health, was the first organization to adopt it and enable hundreds of clinicians on the service. And the outcomes that they were able to measure have been tremendous. Some outcomes that we can share with you now, they're finding that on average, clinicians are saving roughly 40 minutes a day. And if you put that into perspective and think of a clinician that focuses on patients throughout the course of the week, we're talking about hours being saved up and given back to the clinician to focus on more important work. They also found that 84% of clinicians feel as though their documentation experience is much better. And that's because DAX Copilot is on their side, helping perform that task far more efficiently. And then finally, and probably most importantly, they found that 68% believe they're able to provide a better patient experience because with DAX Copilot, they can now focus much more of their effort, their time on the patient and making sure that patient has the right care and treatment. So DAX Copilot is a powerful solution. It's resonating with many different types of care workers. And we hear from healthcare professionals all the time about with DAX Copilot, they're actually enjoying medicine again. And this is why they went into medical school, to provide the best care for patients. With DAX Copilot, they feel they're able to do that again because of the amount of time that we're freeing up with this solution. So DAX Copilot is a powerful solution, and it's resonating with people on the front line of healthcare. Every day, we're hearing testaments from clinicians about how with DAX Copilot, they're getting back to the joy of medicine because they're able to focus more time and energy on providing better care for patients. And that's because DAX Copilot is freeing up so much more time in that administrative note-taking. Now, while DAX Copilot is solving one big problem, we're also building healthcare capabilities into Azure that can help healthcare organizations solve some of their other challenges. As we keep reinforcing, there is so much data now buried inside of healthcare. And healthcare organizations, payers, life science organizations alike now can look at this data to draw more meaningful insights and connections within this data that was simply not possible before. To simplify how organizations can harness the power of AI, what we've built into Azure AI Insights are some pre-built models and templates that can power very specific use cases for organizations. A few examples of those include a patient timeline AI service. This is where an organization can provide historical information about the patient. And this AI service will extract all the meaningful events from that patient's history, things like diagnoses, medications, and procedures, and organize those events into a chronological order to give the care team a unique view into that patient's care and how they got to that point in time to make sure the care team is fully informed about what might be important to consider for that patient moving forward. A second service is a clinical report simplification AI capability. We know in healthcare, there's a tremendous amount of medical jargon where unless you have gone to medical school, it's not going to be something that's easy to understand. And so with this service, organizations can bring in medical content and use this service to translate that into something that's understandable for a typical patient in everyday language. You can think about discharge summaries as an example and simplifying those into patient instructions that are simple to understand and follow. And then third, we have a radiology AI insight service that looks at changes in images over time and provides to the radiology team some recommendations for follow-up in the care of the patient. And then finally, we should also mention that we've added generative AI to our AI health bots and virtual assistant capabilities. So with this ability now, you can access information from reputable sources like the National Institute of Health, but you can also bring in your own custom data and allow your organization to get insights from that data. So we're going to go ahead and look at some examples of how healthcare organizations are using these new AI capabilities in Azure. We're going to go ahead and roll the video now.
Clinicians spend more than 40% of their time doing paperwork, such as charting notes for patients. This leads to inefficiency and clinical burnout. Infusing AI across their administrative day-to-day helps save time and enable caregivers to focus on patients. We'll show you how Dani, a data analyst, empowers her organization by infusing AI and business intelligence to help teams derive meaningful insights and help decision-making, productivity, and the ability to improve patient care management. Using Microsoft Fabric, Dani has brought together all health-relevant data across her organization to have an AI-ready data estate. This data is anomalized to protect patient information. Once Dani has this repository of analytical data, she can enable new healthcare models using Azure AI services across the patient journey. Now let's see how Jim, a population health director, uses a single source of data and AI models for a new care program that reduces readmissions. Jim uses Power BI Copilot to show him the top 10 reasons for patient in-person visits. The report is automatically generated, giving him the ability to adapt visuals, as well as providing an automated summary of patient trends, all with the use of natural language. He can now take this summary and share it with his team, something that would have taken him hours to do in the past. The data and AI models in Microsoft Fabric can also be used by clinicians. Dr. Irene, the CMO, and her team of clinicians have historically faced the ongoing challenges of disconnected data with a significant administrative burden. AI is helping streamline all of this. With Azure AI services and new models such as the patient timeline, they can start to use health-relevant data to give them a complete view of a patient's medical history. Clinicians can also explore evidence touchpoints, and AI models can be used to derive context. For example, the Radiology Insights model can supplement the patient timeline by enabling a focused insight to assist a clinician. When bringing together a consultation, which can be described using DAX Copilot, the resulting report shared with a patient can leverage a simplification AI model, where the clinician can use Copilot to simplify the report into a format that is understandable to the patient. When Patty, a patient, receives her consultation report, she uses the Azure AI HealthBot, now infused with generative AI, via her patient portal to ask for further clarifications. By typing her question, the HealthBot responds with natural language, using verifiable sources such as the National Institute of Health, along with a qualifier that the information does not replace a full medical consultation. Microsoft Fabric and the rich range of healthcare Azure AI services breaks down traditional data silos, all with industry standards and following the principles of responsible AI. In summary, AI can significantly complement the administrative tasks of clinicians and help patients navigate terminology to inform their understanding. We saw how Dani used Microsoft Fabric with healthcare-relevant data capabilities. Jim created a Power BI report without any technical skills, using only language. Dr. Irene used health-relevant data of patients to deliver some impactful care plans, then used the models to help provide a complete timeline and insights for a patient. Lastly, we saw the patient, Patty, leverage tools such as Azure AI HealthBot to clarify terms in understandable language, all while following the principles of responsible AI. Better experiences, better insights, better care with Microsoft Cloud for Healthcare. Learn more at aka.ms/cloud for healthcare.
So these are such amazing examples of how AI can help organizations simplify the way that work is being done, with the ultimate benefit of helping those organizations provide better experiences and better care. We're excited about these new services that are available, but to be honest, this is just the tip of the iceberg of what we envision being available in the future. I'm going to now turn it back to Kees.
Ken, thank you so much for joining me today. It's important to know that while we're excited about enabling your adoption of AI quickly, we are focusing on helping every organization build responsibly from day one of their AI journey. We believe that every conversation about AI should include an intentional focus on trust. And when it comes to patient data, we know that safeguarding your information is paramount. Trust has been at the fundamental promise of the Microsoft Cloud since the very beginning, and it extends to all our AI services. We have three key principles that guide our approach for customers. 1. your data is your data. It's yours to choose how you want to leverage and monetize. Second, your data is not used to train or enrich the foundational AI models used by others without your permission. And thirdly, your data and AI models are protected at every step by the most comprehensive enterprise compliance and security controls in the industry. As we know, the patient is at the center of your decisions, and we are applying the same lens when we look at the potential of AI in healthcare. As we talked about today, we are already seeing it to help deliver better experiences, unlock better insights, and enable better care for everyone along the care continuum. The data that you have within your reach has the potential to do so much good. And with the right data strategy in place, health organizations can revolutionize outcomes for patients, healthcare workers, and their business. Before you leave, here are a few resources where you can learn more. First, visit the Ask the Expert stand at Ignite in Seattle. Secondly, learn more about the Microsoft Cloud for Healthcare. And lastly, learn more about the Nuance solutions. With that, I want to take a moment to thank everyone for their inspiring work that you deliver and lead every day. We look forward to partnering with you to drive meaningful outcomes across the entire healthcare journey. Please enjoy the rest of Ignite.